Hey y'all, thanks for joining another session of Two with Tim, Year in Review. Once again, talking about the silver lining in 2020, another great opportunity to have that discussions around the COVID relief packages and the importance of testing. Let me just say this at the beginning though. Thank you all for taking seriously the social protocols, the washing your hands for 20 seconds, wearing masks when you're closer than 5 feet, 6 feet away, doing those things that have really helped keep our state safe and healthy as well as our country. I have with me today Connor, who's my expert on healthcare. He's actually the Deputy Legislative Director as well. Connor, let's talk for a few minutes about some of the important lessons that we learned about protecting those folks, the most vulnerable in our nursing homes. The good news is, as we head into the vaccine and talk about testing, there's been a big emphasis on nursing homes.
Absolutely, sir. I think one of the biggest lessons learned is we need to leverage public-private partnerships. We have seen nearly 300 different tests and test-related technologies given emergency use authorizations specifically for COVID-19. We're just talking in the last 8-9 months. That is a phenomenal piece of progress that was the direct result of private sector innovation with FDA, with other federal agencies coming to the table, all hands on deck approach. And as a result of that, we are seeing millions of tests on a daily basis. You look at South Carolina alone, when you reached out in April, which feels like a few short months ago, to Governor McMaster and to Secretary Azar, and you said, we need to be all hands on deck when it comes to increasing testing capacity. Yes. We had performed roughly 15,000 tests in South Carolina. Now, we're performing around 15,000 tests a day.
Wow.
In the Palmetto State.
Well, I'm glad
this
we
is
wrote
groundbreaking.
that. I mean, that was an important part of the engagement with our state government to make sure that they understood the sense of urgency that we had around making sure that we took care of the most vulnerable populations in our state. Thank you for your help on that letter, and frankly, thank you to Governor McMaster and the state of South Carolina for responding so quickly to that response, to that request. It was really important, and frankly, I think we're really heading in the right direction on vaccines and more testing. I saw on the news recently that some of our major departments, stores are going to start carrying home tests. That's great news for the public, and it's great news for South Carolina. Any other really important highlights you want to make in the next 20 or 30 seconds?
Absolutely, sir. I think first off, we've learned that telehealth access is incredibly important, especially for our seniors. We need to modernize our legislation and regulations around telehealth access.
Absolutely.
And I think in terms of vaccine innovation, we've learned the importance of biomedical innovation and the phenomenal academic research centers that we have in places like South Carolina,
yes.
The innovative biotech and biopharma companies, and the federal government coming to the table with these folks and saying, we can get this done. We can do the impossible at warp speed. The fact that we're going to see the general public vaccinated by middle of next year
yes.
is phenomenal and totally unprecedented.
Yeah. And when he said unprecedented, never in the history of the world could we have expected a vaccine this fast. We're not talking about just warp speed. This is something literally never even dreamed of before March of this year. As tough as it has been, as challenging as it still is, the truth of the matter is the private sector innovation machine that sometimes we take for granted has helped us overcome one of the greatest challenges our nation's ever seen.